what constitutes clinical stability or clinical instability of a spine are Punjabi and White. Punjabi and White, a biomechanical engineer and also a surgeon. And they put forth an important book. It's Clinical Biomechanics of the Spine. The first edition, 1978 or 79. The second one was 1990. Is a major reference on that we refer to when we want to study spinal biomechanics and understand the importance of different structures in terms of range of motion and different approaches in terms of biomechanical spinal stabilization and implants. So what did they say about spinal instability? A stable spine is a spine that under physiologic loads is free from deformity, neurological deficit, and or pain. So a stable spine is a spine that is under physiologic loads, free from deformity, pain, and or neurological injury. Okay. Over the years, there have been many different classification systems. Initially, these classification systems were more descriptive, but more recently, they were more important because they did not only describe how the fractures look like, but they help guide treatment plans by helping treating physicians, surgeons, make an assessment as to whether the spines are stable or not.
Hey everyone, Ryan Rad here from Neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.